You can use a room deodorizer or try and find the source of the unpleasant odor. Maybe there's some soiled clothing or a soiled disposable incontinent product that's been placed in a wastebasket that hasn't yet been removed from their room. Do what you can to eliminate noise. If they have a roommate and they're watching television or listening to the radio or their lights are on, you may want to ask them to turn down the noise and to turn down the lights. Adjust the room temperature. Offer an extra blanket. Because our bodies are less active while we're sleeping, many of us will get cold during the night. And then finally close the door to ensure for privacy and again to cut down on some of the noises in their environment. There are other things that we should consider to help with people getting a good night's rest, like avoiding vigorous physical activity just before bedtime. We all know that exercise is good for the body, but when it's done right before bedtime, it would interfere with a good night's sleep. Exercise causes chemicals to be released that actually stimulate the body. So avoid vigorous activity for at least 2 hours before bed. Encourage a bedtime routine. Maybe reading, listening to the radio, praying, or meditating might be some activities that would encourage them to settle down. Report any complaints of pain to the nurse or other appropriate person. If the patient has been given pain medication, you'll want to wait at least 30 minutes before assisting with bedtime procedures to give the medication a chance to work. Ask for input from the patient or the resident about their bedtime rituals. Maybe they're accustomed to a warm glass of milk or perhaps a light snack before going to bed. Sometimes, despite our best efforts, patients will have difficulty sleeping. There are certain sleep disorders that may be responsible for this. But do remember that difficulty sleeping just 1 or 2 nights should not be considered a sleep disorder. But let's take a look at some of those that do exist. Insomnia is a chronic lack of sleep. It is a decrease in the quality or quantity of sleep. It occurs because sleep has ended or has been interrupted prematurely. Maybe there's been a noise in the hall. An unexpected phone call comes during the night. Hypersomnia is excessive daytime sleepiness. A person who sleeps very late in the morning and requires many naps during the day may be suffering from hypersomnia. However, other medical and psychological conditions such as depression need to be ruled out. Always inform the nurse of a change in a person's sleep pattern. Narcolepsy is another sleep disorder that is actually a neurological condition that affects the central nervous system, that is the brain and the nerves throughout the body. It is a disorder where the patient experiences excessive daytime sleepiness. It is not the same thing as hypersomnia. The main symptoms of narcolepsy are excessive daytime sleepiness and abnormal REM sleep. It is an overwhelming and recurring need to sleep at times when you would normally want to be awake. About 1 in every 2,000 people suffer from narcolepsy, and symptoms usually will appear during the ages of 15 to 30. The disorder needs to be diagnosed by a sleep clinic. The majority of narcoleptic patients are undiagnosed because many do not consult a physician, thinking that the sleepiness itself is not a disease. People who suffer from narcolepsy have been found to have serious social and psychological problems in the areas of work, leisure, and interpersonal relationships. Narcoleptics, as you might imagine, are also more prone to accidents. So it is very important for an early diagnosis to be made so that people can receive proper treatment in the way of medications and learn how to live with their disease. The last disorder regarding sleep that we'll talk about is sleep apnea. This can be a very serious medical condition because the person will actually stop breathing for 30 to 60-second intervals many times during the hours of sleep. The trachea, or windpipe as some of us know it, will close partially, and you will hear the individual grunt, snort, or snore. The pulse rate slows and may become irregular. The brain will sense this lack of oxygen and awaken the sleeper for 5 to 10 seconds, although they won't even be aware of it. The person takes a deep breath, falls back asleep, only to awaken again as another cycle begins. Sleep apnea victims have no idea that they are constantly waking up. As a result, they are deprived of REM sleep, which will be seen as daytime sleepiness or chronic fatigue. Sleep apnea is caused by many different things, but usually it's because of a narrowed airway. The accumulation of fat tissue in the neck of an obese person can cause this narrowing, but so can enlarged tonsils or tongue, jaw deformities, or growth in the neck can also block the airway. Use of a continuous positive airway pressure device, also known as a CPAP, is very often used to remedy this problem. It is the most effective treatment for sleep apnea. Notice on the picture that the patient wears a mask over the nose during sleep. Pressure from an air blower forces air through the nasal passages. The pressure is adjusted so that it is just enough to prevent the throat from collapsing during sleep. And all of this ensures a much more restful sleep for the individual. Another topic to consider when talking about comfort needs is the subject of pain. When we experience pain, we think of it as a bad thing, but it is actually a protective mechanism. It is a signal to us that something is wrong and we need to seek some treatment. Unrelieved pain disrupts the quality of a patient's life and makes it difficult or impossible to perform routine activities of daily living. Pain interferes with comfort, rest, and sleep. It causes stress and anxiety in our lives, which can lead to depression. Pain can be prevented and treated when it occurs. It is a major responsibility of the caregiving staff to identify pain in patients and then take steps to relieve it. How we react to pain is different for all of us because we are all very unique individuals. But some of the things that will influence that will be our previous experiences with pain. Maybe you're taking care of somebody who is elderly and just experiencing a surgical procedure for the first time. Our current state of health. Someone who has a debilitating chronic illness is going to react differently to their pain than someone who has been young and healthy. Lack of sleep also affects how we react to pain. Think how difficult it is to cope with the stresses of everyday life when we're sleep deprived. And when you put on top of that pain that the person may be experiencing, it makes it all that much more difficult. We also learn about how to react to pain from the members of our family and the other adults that have been influential in our lives. Our culture has a very great impact in how we react to pain. Some cultures are very emotional and very expressive when they are dealing with pain, and others are more stoic, kind of the stiff upper lip attitude that is taken. The amount of distractions that are present also influence how we react to pain. I've often noticed that when a patient is watching television, talking on the phone, or visiting with their company, their reaction to pain is quite different when they are in the room by themselves. There are many different types of pain. Let me talk about a few of them with you. Acute pain is sudden and often very traumatic. You know exactly where it hurts, and generally the cause of the pain is known. It is pain that results from tissue damage, either from surgery or from an injury. It usually will decrease over time as healing takes place. Chronic pain is more persistent, and it lasts longer.